Carlos Becerra, founder of North American Medical, the inventor of records for both the DRS machine and the Accu-SPINA. As a friend of Dr. Alan Dyer and of Dr. Norman Chile, I would like to recount an accurate history of the decompression industry as someone who was actually involved in its formation and development. If you don't mind, I would like to introduce my beautiful daughter Gisette Becerra Rubin to set the record straight.
Thank you, Dad. When you invest in a high-end medical device, you rely on the performance of that device as well as the integrity of the people behind it. I was recently shown a video that presented some erroneous comments. In the interest of correcting that misinformation, I would like to review some of the claims made and provide credible sources from the record. Dr. Alan Dyer did in fact invent and develop the first modern-day table that was able to prove decompression. The landmark VAX-D study by Ramos and Martin showed an amazing drop in intradiscal pressures. The statement is true, but here is where the marketing spin begins.
The keynote is that they were able to do so using the logarithmic curve that was invented by Dr. Alan Dyer. And it's the same type of curve that's used on the DRX 9000 today.
Well, perhaps the DRX 9000 does use VAX-D's logarithmic curve. However, the Ramos and Martin study did not. The logarithmic curve was not invented or patented by Dr. Dyer until 4 years later. It is also important to note that the VAX-D, while immensely successful, achieved positive outcomes of 71 to 76%. Very good for the technology available at the time. In 1998 is when the DRS was introduced, the first tower designed to achieve an angle that allowed specific vertebral targeting. Excite critics, Dr. Norm Shealy, which is not inaccurate, but my father was conveniently not mentioned here. In fact, Carlos Becerra is the first person named on that patent because he developed the device, while Dr. Shealy provided the clinical insight. Here's the original panel from that DRS system. This user interface should look familiar to some of you. Carlos Becerra and Dr. Norman Shealy's advancements were specifically designed to provide better biomechanics. By doing so, the DRS achieved better outcomes and saved many rotator cuffs. The claim that the Accu-SPINA was created in 1998 is simply untrue. The truth is that the DRS system came out in 1998, not the Accu-SPINA. The SPINA system came out next, also created by Carlos Becerra in the year 2000. A year later, the DRX came out with many of the same innovations originally created by my father. In 2003, 2 years after the DRX 9000, North American Medical introduced the first Accu-SPINA. While the Accu-SPINA aesthetic may have resembled his DRS, it was the first device of its type to utilize a Windows operating system due to the complexity of its sinusoidal waveform and oscillatory signaling frequency. With its significant upgrades, the Accu-SPINA was found in subsequent studies to have the highest successful outcomes in decompression from 86 to 92%. The most audacious claim from Excite is this statement.
While the DRS, they had a challenge in using the logarithmic curve, so that's where they came out with that oscillating feature in their pull. When they came out with the DRX 9000, they were able to figure out a way around the patent, and they were able to use that logarithmic curve pull that was proven to drop intradiscal pressure.
Proven? As noted, the logarithmic pattern did not exist in the Ramos and Martin study, so perhaps DRX worked around the pattern, but the Accu-SPINA actually advanced the science with oscillation. Oscillation is a patented addition to our sinusoidal logarithm and is in no way similar to the primary waveform or logarithmic curve. Oscillation enhances decompression first by introducing the additional waveform at the top of the primary distractive forces, working to create a better vacuum effect, like a faster plunger would create better imbibition. Second, at a maximum distraction, the added oscillations can alter GTO response, helping the facets, ligaments, and tendons, while assisting in muscular re-education. Third, research has shown that individual cells respond to variations in their microenvironment, and sinusoidal oscillatory signaling can aid in that adaptation. It is now an accepted fact in medicine that every single organ and cell in the human body is constantly vibrating or oscillating in just such a manner. To illustrate just how different the advancement of decompression with oscillation really is, I want to thank Dr. Paul Rossioli of Haverton, Pennsylvania, who shared this video that he made of oscillation in action on his own Accu-SPINA machine. As you see in this video, the oscillation pattern happens in addition to, not instead of, as many of you may have been led to believe. There were also many references to the precision of the servo motor used in the DRX. While servo motors can be precise, do you want your patient attached to a motor that produces 950 pounds of tension? The Accu-SPINA uses a precision system of graduating gears with a medical grade motor that ensures the smoothest pull with the finest gradient of movement. This is a key safety point of our design and one of the many reasons that the Accu-SPINA has never had a personal injury claim. An independent review performed by Georgia Tech PhD and Professor of Engineering concluded our decompression design was more precise and safer than the servo motor device. This report can be found on our website. I would like to address some veiled insinuations that were made regarding the Accu-SPINA. The Accu-SPINA allows the clinician to select the angle at the push of a button. However, because people are made of different heights and shapes, the inclinometer provides a precise measurement for optimal treatment. And there is a reason we use an external bladder as opposed to inside the bed cushion. The bladder is made to support the lordosis, so by putting it into the harness, you're assured perfect placement every time, regardless of where the patient is on the bed. Sometimes simplicity is superior. Excite states they use a monitor to help the patient relax. Interestingly, when we spoke with Drs. Dyer and Shuley about watching TV during treatment many years ago, both express the same sentiment. Television stimulates the optic nerve, causing a neurological response to what they're viewing, inducing a muscular reaction, detracting from treatment. The protocols used on the Accu-SPINA were developed by Dr. Shealy, an eminent neurosurgeon and the personal physician for the Kennedy and Eisenhower families. The VAX-D protocols were developed by Dr. Alan Dyer, the former Minister of Health in Canada. Who created the protocols for the DRX 9000? In conclusion, I found the following statement of particular interest. Quote,
The fun thing is, not only is it the most innovative and advanced decompression system in the world, it happens to also be the most researched.
as to innovation, the DRX 9000 has exactly 0 issued patents, while Carlos Becerra and North American Medical have 6 issued and more pending. Furthermore, we invite anyone who is interested in comparing the quantity and quality of the studies done on both machines to determine for themselves who the true innovators and market leaders are. While the DRX 9000 has been manufactured under many company names, North American Medical is a family-owned business operating for more than 22 years without interruption. Thank you for allowing me the opportunity to recount the true history of decompression. If you would like a copy of our clinical compendium or links to any of the information discussed herein, please email us at iddinfo@namcorporation.com.